Good evening, everyone. Today we are going to start Unit 9, that is Social Health Insurance. So, what is the social health insurance? Nowadays, if you see this health insurance offers uh, to protect oneself or also to protect our family members, family members from any financial distress and crisis through this health insurance. And like if you see this wise people, right? Wise people and people who can afford it can really insure themselves and also for their family members. Okay. To increase the life expectancy. And nowadays, if you see the poor people, those who, even though if they're interested also, they are unable to afford to pay the premiums towards the health insurance. And quality of care is also very important for the critical illnesses like diseases such as cancer, heart diseases, because these treatment for such conditions are like beyond the reach of common man. So sometimes this such type of situations can lead the family members to have a huge financial burden. And next, we will see what is the role of government in healthcare provision and financing. So here, if you see, the government is like nowadays, as the healthcare has become more expensive, but the government are like trying to be engaged in understanding how best to increase the uh, access and how to reduce the financial distress and expensive healthcare in the society. And this government services also include in providing the health awareness, medical educations, and medical services, which are part of a public health service. And next, we will see what is the central government scheme. Okay, you all know what is the central government health scheme, that is CGHS. So, what is the CGHS? Mainly, this is like government of India has offered this medical care to the employees, the pensioners who are working under the central government, and after they have to be get enrolled. Once they get, they have to get enrolled, and this scheme was started in the year like 1954 in Delhi, and now the CGH has a unique facility like in wearing the large number of beneficiaries through the CGHS scheme. And if you see this 38.5 lakh, uh, the 38.5 lakh beneficiaries have been covered by CGHS as on till 2021. And this is like across 74 cities and towns across the world. And next, all systems of medicines are covered like allopathy, homeopathy, Ayurveda, Unani, Siddha, and yoga in the CGHS. Okay, this all system of medicines. Once I repeat, this allopathy, homeopathy, Ayurveda, Unani, Siddha, and yoga are involved in the CGHS scheme. And next, if you see this beneficiaries, like you have certain uh, next, you have certain beneficiaries for the CGHS scheme, that is OPD services. The patient have this OPD services, and the patients may have beneficiaries when they go under certain medical investigations at CGHS scheme wherever it is available, and specialist consultation whenever they want to visit a specialist for their conditions. Okay, that benefit also will be there for the patients, and this reimbursement of expenses. Okay, especially for the surgeries, like when they have when they have any surgery related to hip, or when they have any surgeries related to like knee replacement, any implants related to this ortho, etc. So they have a reimbursement facility, and it also like provides a flexibility to avail the medical care in case of emergency from recognized private hospitals. Okay, this we have been already read about it. Okay, and it is also providing a benefit of cashless treatment in the hospital. Okay, they can just go avail the treatment from the hospital or from the care providers in a network hospital. Okay, and afterwards they get the hospital get a payment from the insurance company after the underwriting have been uh, taken process. And next, like we have this employee state insurance. After the CGHS scheme, we have a next scheme called Employee State Insurance Corporation. So I think you are all aware about this scheme, right? Because in each and every organization, the employees are benefited through this ESI. And this ESI, this is the self-financial social security scheme. If you see, mainly this aim is to like protect the employees covered under the scheme against the financial distress and to provide a financial support to the employees. And this act was started in 1948, called as ESI Act, and it was the first social welfare legislation that was passed by the Parliament of India to mainly offer social security for workers in India. And this organization headquarters is in New Delhi. And so who are eligible for this ESIC? Okay, for this ESI scheme, who are the eligible people? If you take an employee who are working or who must earn a gross month salary of at least rupees like 21,000. Okay, 21,000 or less. Okay, such people are benefited with this ESI scheme, and this ESIC is headed by its chairman and the Union Minister of Labor and Director General, mainly who functions as a Chief Executive Officer. And this Chief Executive Officer is also appointed by the central government. And this ESI, this ESIs are provided across India to the workers, to the family members through the hospital and dispensaries. Okay, and medical care. Okay, mainly the medical care is also provided to the retired and to the permanent disabled people who are insured person and to their spouses on payment of token annually if they are paying a premium of rupees 120. Okay, when they are paying this premium of annual token, it is okay. If they are paying for rupees 120, mainly it provides. So what benefits they get under this is like sickness benefit, maternity benefit, and disabled benefit, etc. And next, we come to social health schemes. So what are the social health schemes? You have certain social health scheme here, which are listed in this particular scheme. So these are mainly offered to the working people, to the voluntary participants, and who can avail the benefit at health insurance of health insurance. So most popularly, if you see the social insurance schemes at the national level of India include the following like Rashtriya Swasthya Bima Yojana, Employee State Insurance Scheme, Central Government Health Insurance Scheme, Aam Aadmi Bima Yojana, Janashri Bima Yojana, and Universal Health Insurance Scheme. So we will just have a look about this. What are these schemes about? So first we will see about this RSBY, that is Rashtriya Swasthya Bima Yojana, and mainly this scheme offers the health insurance coverage to below the poverty line. Okay, they just offer the benefit of this insurance coverage that are who are under the below poverty line families, and this like tend to be like given cashless insurance. They can have a cashless insurance for hospitalization in a public or a private hospital. And next one is ESIS, like which we have discussed in detail, like about this ESIS and CGHS. And next we'll discuss about this Aam Aadmi Bima Yojana, and this is a life insurance scheme that was launched on like 2nd October 2007, and it is a social security scheme. Okay, this is mainly a social security scheme which provides the schemes mainly targets to the low income families, like same like if you see below poverty line people, and who are like benefited with this scheme are like fishermen, auto drivers, etc. Okay, those who have a very like low income families, they can opt and have a benefit with this Aam Aadmi Bima Yojana. And next we have this Janashri Bima Yojana. So what is this Janashri Bima Yojana? It is also a government scheme mainly by a central government and life insurance corporation. It is a combined scheme. And this mainly offers protection to the people who are living under rural and urban areas. Okay, this is about Janashri Bima Yojana, just to have an idea about this schemes in detail. Okay, and next, like we just see what is this universal health scheme. Okay, coming to this universal health scheme. So this Universal health scheme is offered by a central government and it is through a public sector insurance companies. So mainly this will offer coverage to the people and to their families. Okay, this will offer coverage to the people and to the families who are between under the age of like group of 3 months and 63 months and also to the 65 years old people. Okay, it is not like that. Okay, for certain age they can take this scheme, but this scheme is like starting from 3 months old child to 65 years old person. Okay, and this insured or the policy holder, what they can do is if they are interested to continue this policy beyond 65 years, yes, they can renew the policy beyond the age of 65 years, and this uh, benefit has been provided for them, and there is no break in insurance in this universal insurance. And in the scheme, if you see, this was launched in 2003. Yes, this was launched in 2003 by the Minister of Health and Family Welfare. And like here, you have benefits for this policy, like poverty line and below poverty line. So first we will see what are these benefits. Like if you see here, uh, policy is available for the families or for the groups that consist more than 100, for more than 100 families to those who are with the lesser incomes. Okay, like if you see, we will talk about above poverty line first. So in this above poverty line, what happens is if the individual is paying a premium of about, she have to pay like 365 rupees, and the family who are like staying up to 5 members, okay, they have to pay 548 rupees. And for the 7 members, if the family is consisting with 7 members, then they have to pay 730 rupees. Okay, then they have to pay 730 rupees. This is for the people who are like above poverty line. Okay, the individual have to pay, if it is only for an individual, the individual have to pay 365 rupees. And if the family who are like up to 5 members, they have to pay 548, and 7 members, they have to pay 730. And the policy is available for all the family members and also for the group. So next we will see for the less incomes. Okay, that is for the below poverty line people. So what are the uh, premiums they have to pay? What is the premium rate? Okay, for individual, the individual can only pay 300 rupees, where it is for the above poverty line it was 365, and for the uh, below poverty line for an individual it is 300 rupees. And for the families up to 5 members it is 450. Okay, for the families up to 5 members it is 450, whereas we have seen for above poverty line it was 548. Okay, and coming to the 7 members in a family, then they have to pay 600 rupees of premium. Okay, premium rate will be 600 rupees for the people who are like staying for 7 members in a family. And for the above poverty line, we have seen like they have to pay 730 rupees. But for the below poverty line, they have to pay 600 rupees for 7 members. And there are like other benefits with this universal health scheme, like personal accident insurance. Okay, personal accident insurance, whereas it covers, mainly it covers to the primary income earners, and to the uh, whereas mainly it will compensate to the family in case of death. Okay, mainly in this, if you see the personal accident insurance, mainly it covers to the primary income earners, and it will compensate to the family in case if there is any death, um, and if the insured, okay, here what happens is the insured will receive rupees 25,000 if one family head passes away in such case. And next you see hospitalization expenses benefit, okay, at least 30,000. Okay, they at least pay up to 30,000 hospitalization expenses. And if you see this for the disability compensation, okay, next you have a disability compensation. And for this disability compensation, after 3 days, okay, after 3 days of waiting period, the insurer will start paying like only rupees 50 per day. Okay, the patient have to pay only uh, 50 per day if the primary policy holder or the spouse is admitted due to any illness, disease, or accident. And next, coming to the personal accident cover, here the insurer will pay or the insurer will receive rupees 25,000 in an event like when there are, if the main policy holder of the plan or the family head passes away, then they are going to receive like rupees 25,000. So these are certain schemes of healthcare, like we have seen about this social health schemes also. So here in this, we just have a topic about the social health schemes. Just we will revise about what is. So we have discussed what are the following included schemes that are included in the social health insurance. So here just we will see what is the social health scheme. So mainly this is offered to working people who are working under like voluntary participants, and they can avail the benefit of health insurance. So health insurance here. So this was about the topic for today, that is like health, social health insurances. Thank you.